But first, we're going to hear more about the adolescent town halls that we heard about in the plenary, as well as some 1.8 news reporters. Here we go.
Unite! Unite! Rise! Rise! Lead! Lead!
Создавая безопасные платформы, создавая безопасные диалоги, где они могут задавать свои вопросы и получать точные на них ответы.
We demand that the government develops and enforces anti-bullying policies and trains staff and students on how to prevent them.
I wish to address the obstacles we are facing on the disruption of girls' education in the aftermath of the recent earthquake.
My participation in the Adolescent Girl Town Hall was motivated by the lack of transparency and support systems for adolescent victims of gender-based violence in my community, which stems from our autonomy being ignored.
We need to count on us as adolescent leaders not only to be beneficiaries of state programs, but to be part of the planning processes and implementation of state policies.
We drafted recommendations for civil society, philanthropies, and member states, and we hope you would join us in making sure that all girls get a chance to make the world a better place.
It is our hope that these recommendations are not just listened to, but are also acted upon. We really want to live in a world where the voices and aspirations of adolescent girls are actually listened and upheld.
Youth make up to 16% of the global population, which makes us a huge demographic group, and which is why it is very important to bring us into these spaces where these different topics are being discussed. So we have a huge potential to shape a better and healthier future for all. We bring the creativity, we bring the fresh perspectives and ideas into the discussion, and so we need to be equal partners in the decision-making processes.
More than any man can give to you, baby. 'Cause you were beautiful to me. I know many guys that love me, but I'm the only one for you. See all the love.
As a kid growing up in Norway, I grew up diagnosed with ADHD and dyslexic, and I was having a lot of problems with a lot of energy and didn't know what to do with all that burst of energy. And having a place where I can go and dance and have people with different colors and different cultures just take me in as a kid, letting me burst out with the energy with dance and with each other was just the most perfect thing growing up with. And I think it just shows how much it just contributed to my life and how I am now. So yeah.
Absolutely. I love all of those answers. Thank you for sharing that.
Excellencies, distinguished guests, I'd like first to thank you for the opportunity to bring in the perspectives of young healthcare professionals to this very important roundtable. It was only 6 months ago when my country, Egypt, hosted the UN Climate Change Conference in Sharm el-Sheikh. And I was lucky to be appointed by the COP27 president as a young medical doctor who herself saw the detrimental impacts of climate change on her patients and generation as the first official youth envoy. 1.8 billion young people, including children and adolescents, are now shouldering the impacts of climate change on their lives and livelihoods. Almost 1/3 of deaths of children under the age of 5 is directly linked to environmental degradation. 1 out of 5 children lack access to safe drinking water, while air pollution affects young people the hardest. This is also combined with the exacerbation of the inequalities in access to healthcare services, education, and decent job opportunities, especially for young women and girls who make up 90% of the climate migrant population, and also experience gender-based discrimination and violence that is aggravated by the scarcity of resources. Climate change is also affecting the mental health of young people, from despair at the unpredictable climate disasters to the anxiety about the future of mankind. These feelings are further heightened by the disconnect between young people and their governments and public institutions. Yet, I'm not here to tell the story of my generation's distress, distrust, and disappointment. I'm here to share that young people around the world are leading the climate challenge. They are doing this with innovation, with dedication, and most importantly, with a powerful health argument that climate action is going to provide the conditions for a world where no one has to ever face any health challenges. Creating resilient societies with cleaner air, access to green spaces, safer sources of energy, as well as a well-connected community. I'm proud to be part of the beautiful health community of young healthcare professionals who believe in their responsibility as the first-line responders to the impacts of climate change on health. Medical students are working with their institutions to integrate climate change in curriculum. Young health practitioners are prescribing nature to improve their patients' well-being when connecting with nature, as well as decarbonizing their healthcare facilities. However, such youth-led bottom-up approaches remain siloed from the top-down negotiation processes because of the little dialogue between the ministers that are in the negotiating rooms and young people who are on the outside.
Unite! Unite! Rise! Rise! Lead! Lead! Young people, this is our time.
Welcome everyone to today's interactive conversation, which is adolescent global adolescent priorities. Today we are not only going to be able to speak as well as to chat, but also we are going to reflect on the conversation a few young people had with the Minister of International Development. Andrew Michaels at the Foreign and Commonwealth Development Office. Today with me, I'm not alone. I'm also with my colleague Tanya, as well as Erida from the FCDO. Uh, in the conversation, we weren't alone. We are also with our colleagues who are not present today. This is Gareth from PMNSH, as well as Ominia from FI International. Without going further with my conversation, allow me to introduce myself. I'm Queen Kimi Mandira from Malawi, working with Plan International as well as Haribati. Over to you, Tanya.
Hi, my name is Tanya. I'm here on behalf of Restless Development. I am a global health ambassador and I've done schemes on period poverty and sexual health and reproductive services and rights. I'll pass over to Chris now.
Work at the United Kingdom's Foreign, Commonwealth and Development Office. I'm a Deputy Director and I head up a department called Human Development Department. And my department do our work on global health. So we cover sexual reproductive health and rights. We cover health systems, including mental health, nutrition, climate change impact on health, and WASH. Right, back to you, Kimi.
Thank you so much, everyone. And also, viewers, you can be able to be commenting in the comment section so that you can be able to know one another and interact, where you're from, as well as which organization are you affiliated to. Let me go further and explain the background of this event and the event which we heard with the Minister of the International Development. So this conversation was held for adolescents to be able to come up with their priorities as well as concerns which they do face in their respective communities. So in today's conversation as well, everyone is given a chance to write down as well as point out your main priorities when it comes to adolescent healthy as well as well-being. So there is a poll which is going to be highlighted on your screen, which you should be able to point out your priorities as well as the concerns which is there when it comes to the healthy as well as the well-being of adolescents. And also don't be limited to only point out to the multiple choices which they are being given. You can also be able to write down in the comment section what is it that when it comes to the well-being as well as healthy for the adolescent, which are these you can be pointing out. So feel free to use the chat box as you're interacting with one another and also to be pointing out which ones are your priorities. Hopefully everyone is being able to be pointing out as well as writing down the concerns by the use of the poll. This is an interactive conversation and we would like to be hearing from you as well. It's the reason why we ask concerns and how are you pointing out these concerns? Before we highlight the points and the answers which you guys have pointed out through the poll as well as in the comment section, allow me as well to go and put up the video, which is going to be reflecting our chat with the minister. And it was really amazing chance for us, the young people, that we interacted with him nicely, and he was able to answer to our concern, to listen to our concern. And one best thing which I loved, it was that he highlighted to say that you are not supposed to be finding solutions to your own problems, but as young people, as the readers of tomorrow, you have to be able to give us the problems, and we, the readers, should be able to be giving you the answers and finding out solutions to your concerns as readers. So
I think what Kimmy was emphasizing there was just the encouragement of youth voice and being able to have something to say and speaking up about it, and not only being heard by the young people around us, but the leaders and the figures that are able to make actual change. Thanks, Kimmy.
So we'd just like to welcome you, Minister, and thank you so much for coming today. We'll start off with some introductions. So my name is Tanya.
My name's Gareth. I'm with the Partnership for Maternal, Newborn and Child Health.
Aha, yep.
Pass to my colleague Kimmy here on the laptop.
Hello, my name is Queen Kimi Mwandira from Malawi. I'm working with Haribate and Brand Malawi.
Thank you very much indeed for coming into the conversation from Malawi.
And hi, I'm Omnia. So I work with as the youth envoy for the COP27 presidency, but also supporting FIA Foundation.
And are you going to be involved in COP28 at all?
Yes.
Yeah.
Yes, very much. Focusing also on the youth as well as the health, because I'm also a medical doctor by background.
Ah.
So as you know, the Global Forum for Adolescents shines a spotlight on adolescent health and well-being. And obviously we are pleased to have this opportunity to talk to you today. We do know that adolescent health and well-being is an important agenda for the UK government and yourself within its international development work. So our first question would be, what is the UK currently doing to engage with the Global Forum for Adolescents and development commitments to adolescent health and well-being?
Well, we recognise the importance of engaging with adolescents, and we recognise the importance of health. I was just talking to a group of young people downstairs about climate change in the run-up to the COP. And also we were reflecting that when I was on a visit to Mozambique earlier this year, this is a country where we've managed to reduce by 50% the infection rate from mosquitoes and on malaria. And we've driven it down over recent years. But because of climate change and because of the flooding, for the first time, malaria is now on the increase. Malaria is a disease which tragically but unnecessarily kills thousands of children every week. And it's a very sharp example of the dangers of climate change and health. But we are profoundly conscious of the challenges to young people at this time, and the needs for governments to listen. And while we don't expect necessarily young people to know the answers, it's only right that they should press us to find the answers. So I hope we're engaging in a humble way to listen, but also to take away the challenges and try and do something about them.
No, that sounds great. We can honestly appreciate as well that you're not just being an ally to these young people, but advocating for them as they express their issues to you.
Yeah, I just want to thank you for those remarks. I think you've touched on something quite important, which is sort of the interconnectedness between health and other topics. And so at PMNCH, we've been mobilizing a lot of our youth-led partners across the globe in all the different regions to tell us what they want, what are their priorities, through the What Young People Want campaign. And through that, we've had over 1 million responses, so one of the largest data sets on the priorities for adolescent health and well-being, I think, ever. And actually what's come out very clearly is that health is a priority, but others are topping that feed into health. So actually what came out very, very strongly was that employment, education and skills was like far and away the most important topic that adolescents are looking for support with their well-being. And indeed, I was doing some work a couple years ago on sort of HIV prevention research. And again, the top thing that came out was actually employability and employment, and not just in a gig economy, not informal employment, but good jobs, good careers that are really key to supporting that holistic nature of well-being. So I guess if not so much of a question, but really just to underscore the importance of listening to what young people are telling us in adolescence, which is that these skills, this employment, this education is so key to their health, and that when we're looking at these interventions, whether that be in Mozambique or any other country that you're working in, to really just see how can we bring in all those other aspects, all those other holistic aspects into the health agenda.
That's a really, really good point. I mean, one of the things that we do here is to try and put girls at the centre of everything we do in international development. And that means three things. It means education, because if you want to change the world, there's many ways of doing it, but the most effective way is to educate girls. And if you educate a girl, she'll get married later. She will make sure her own children are educated and they will get married later. She will take a bigger role in her family and in her community. And she's also likely to be economically active. And your point about jobs, very interesting, because I asked the Secretary General of the Commonwealth the question, what is, in her view, is the biggest challenge in Africa? And I asked the same question of the Secretary General of the Francophonie, the French version of the Commonwealth, and they both gave exactly the same answer. They said the biggest challenge is to find jobs for young people going forward. And we're going to have a meeting in London to focus directly on that with both of them there, to try and see what we can do to advance the agenda that you set out so eloquently.
I think I'll hand over again to my colleague Queen.
Allow me to share with you the experience of Malawi in issues to do with sexual reproductive healthy rights. We do have vulnerable groups of adolescents that need special attention on issues to do with sexual reproductive health rights and services. For example, recently we had Cyclone Freddy, which negatively impacted adolescent girls, for our government did not prioritize issues to do with sexual reproductive healthy rights, but rather food and shelter. By the end, there was high levels of teenage pregnancies, and which led to unsafe abortion. Same applies to my fellow adolescents who are in the rural areas. They do not have access to sexual reproductive healthy rights as urban adolescents do. As a result, there is high levels of school dropout, which has come up due to teenage pregnancies, which is the result of lack of knowledge in sexual reproductive healthy rights. From this, for me, it's essential that the UK government invests in the sexual reproductive healthy rights and services of these groups by drawing on the experiences of adolescent girls, particularly in the humanitarian crisis, as well as within the rural areas. Thank you.
So that is really, really interesting. And when I was talking about how we put girls and women at the centre of everything we do in international development, I mentioned education, but the next thing I would have mentioned, there's three. The third thing is trying to prevent sexual violence, which is an appalling crime that takes place all around the world, and where last December in Britain we had a big conference and brought lots of nations together to try and bear down on sexual violence against women. But that's the third thing. The second thing is to try and ensure that women are able to decide for themselves whether and when they have children. Exactly your point. And we've had some success too at lobbying for countries not to exclude girls who do get pregnant from education. Recently, we've been doing some work from Britain in Sierra Leone and in the Cameroons, which has led to a change in the laws and the rules so that girls who are pregnant can go to school. But it's very important also to try and push back child marriage and stop it taking place. And we're very conscious of that. So when we talk about getting girls into school, we mean in making it easier for them, whether it's in terms of having proper hygiene and sanitation in schools, but also giving girls the maximum opportunity to take advantage of a 12-year period of education.
One thing I also wanted to highlight, we discussed how climate change is disproportionately affecting the health and mental well-being of adolescents and young people. A very recent report shows that 98% of African countries, children there are living in between severely high to high risk of climate change and impacts, either directly through death by extreme weather events, or indirectly, as we mentioned, in terms of access to education, to healthcare services, to decent job opportunities, as well as the distress and the anxiety that particularly adolescents feel by the disconnect with their governments in terms of climate action, as well as lack of meaningful integration of their perspectives. We also see another health-driven impact, which is road traffic injuries. It is the leading cause of death in adolescents aged 5 up to 29 years old. But at the same time, this presents a win-win opportunity when we think about addressing both safe and sustainable transport and infrastructure, where now we see impacts related to transport that is one of the leading contributors to the carbon emissions that leads to climate change, and it also leads to air pollution, where 9 out of 10 children globally breathe in polluted air. But at the same time, if we include young people, particularly adolescents and children and young people in the design of policies that are promoting both safe and sustainable transport, promoting safe and cycling and walking pathways, we are not only improving the health of the environment, which in a way sustains us, we're also improving the health and mental well-being of young people globally and in the UK as well.
So how right you are that it is road deaths, particularly in the developing world, that are a major source of trauma and difficulty. And making roads safer is something we try and build into any programs which are infrastructure and road related. And you couldn't be more on the money. It's the biggest killer, and we need to make sure that we build in education and prevention in that area as well.
Thank you so much, Minister, for directly responding to all of our concerns and issues. A question that we do have to ask you finally would be, as you know, adolescents are often overlooked and marginalised in wider society. Within this, young women and girls are also further marginalised. We were therefore happy to note that one of the priorities is empowering girls and young women as one of the 4 development priorities. We wondered, however, if you can tell us how the government will ensure it meaningfully involves and is accountable to adolescents, and especially young girls and young women directly impacted by all these priorities.
Well, again, it's a very good point, and the feedback loop that we always try and set up is very important. Also, by making a focus not so much on the financial support we give, but on the results of what that financial support buys, that's a very good way of boosting the feedback loop, because it means we hold ourselves accountable for the results and not just the inputs. And in order to do that, you need to engage with the people you're trying to assist and to help. So that's one way. Also by building in responses, by holding meetings like this, by making sure that People are able, we're very approachable and accessible, and people are able to give us their views, try to put forward as friendly as possible and in as easy as possible a way for people to respond and tell us what they think. It's extremely important, and it's a very core part of what we try to do in international development, that it's a partnership, and that definition of partnership should include all groups. And after all, you know, my generation is going to leave a world to you which today faces very significant challenges, of which migration is one, the danger of pandemics is another, climate change is another, and we need to make sure that all generations, particularly adolescents and young people, all generations are joined at the hip.
Thank you for answering that question. It's wonderful as well that you were able to kind of voice how the youth versus direct voices directly heard, understood, and actually being partnering with them. We do believe as young people that it's older people's duty to kind of give us the necessary tools to allow certain work to be carried out and for things to come into fruition. So we do appreciate that. That is actually our final question to you.
Well, thank you so much for such interesting and important questions, and for coming into this beautiful room in the British Foreign Office, and for taking the time and trouble to interact. I'm very grateful, and to form part of the feedback loop.
And thank you for engaging with us. We do appreciate it. Thank you so much.
Thank you very much indeed. Thank you.
And he was able to provide us with some type of insight to what some solutions could be, and some insight to what the government also plans to do in the future in regards to these issues. What we're going to do is go into some reflections and learnings from me and Kimmy. But to start off with, I'm going to bring in Chris to let us know his take on why youth participation is so important.
Thanks a lot, Tanya. I do think it's really important. I mean, the first thing is that we're talking about this or policies, people, and we need young people to be part of that conversation, because it's about them, and they're the only ones that can tell us whether what being the right approach is really the right approach. It's really going to have the impact. The second thing, and I've really experienced this myself, is the energy, the enthusiasm, the dynamism that young people bring to it. So I'm on a number of boards where we have a youth participant. I always look forward to them speaking. It's always more dynamic. I've also done quite a lot of these type of conversations where I've heard from young people, and I've just been motivated by that energy. Third thing, and Minister Mitchell said rightly that we're not asking with all the solutions, but actually I have lots of really good ideas from young people. I do think they can input quite a lot, come at it from a different approach. Maybe they've just got fresh ideas, new ideas for us. So it's important to listen for all of those. And I could go on. There's lots of other reasons, but it's really made a huge impact. I certainly will continue to talk to young people, continue to push that they're included.
I completely agree, Chris. Thank you. And I think that also leads into some of what me and Kimmy learned actually in this talk with the minister. I'd say one of my main takes from it would just be for young people to make your voice heard regardless of what parameters may be around you. Even if you can reach a small amount of people, it can make a huge impact, So starting digital campaigns, paper campaigns, local community campaigns, being able to reach out to like-minded people, creating collective voice is always important. And I think engaging other young people to care about the same things you do is something that really allows leaders and decision makers to actually take some type of stance on some of these issues and make noise about it on our behalf. And I'd say just try your best to do it. I'd say what I got from the talk as well was just the fact that we do have the ability to be heard and we have a platform to be heard. And yeah, what about you, Kimi? What did you get?
I completely agree with you, Tanya, as well as I totally say yes, it's true that what Chris said. And also, being an adolescent person, being a young person, it doesn't mean that what you have in your mind, the priorities you have, you don't have to be living out, that you shouldn't be voicing them out. It's better for you to be voicing them out so that these political readers, they should be able to be searching for solutions. And also the problem shouldn't be from us, the young people, to fail and succeed and have our well-being and healthy to be complete. So I agree. So this also, it's giving us to go to our second poll, which is a question, because a lot of people, I think everyone also is having this question in their mind to say that, do you feel heard with these political readers when you're giving your consents? Do you feel heard? Sometimes it can be a yes, or maybe it may be according to how you interact with your political readers in your respective countries. So can we please answer that? As we are answering that, we have amazing comments in the comment section from the last poll which we post. I got caught up from different young people in the poll, where a lot of them, they're supporting to point out their support for education and skills to be the most priority for the young people. And also secondly, it's going to mental healthy support. I agree, because someone, when they're not mentally stable and when they're actually finding difficulties in issues to do with mental health, it can be really a problem for them to succeed. As well as they have also pointed out a very important thing from and to say sexual reproductive healthy rights is also the main issue to talk about as a priority. As also, I agree, because this was my point when I was chatting with when we were chatting with the minister. This was also a point from my side to say that sexual reproductive healthy rights should be a priority to young people. And also, we have an amazing question. This is from I'm very sorry if I'm going, but then
I think it looks like you might be breaking up.
problems of stigma.
Kimi, are you back with us? Hello?
Yeah, we
Yes,
lost
I'm
you there,
very
Kimi.
sorry.
We lost you for a second. It was breaking up. Do you want to repeat the question?
Oh, okay. So James is saying that most teenagers face problems of stigma, and need
I think I'll take
We're
you
losing.
out. Kimi, yes. Let's see what question she was answering. So one of the first questions that we did get was, let's see. Most teenagers face problems of stigma.
most African countries are with this.
Sorry, we
So
lost you
most teenagers.
again, Kimi.
So just to repeat Kimi's question, James Niwagaba from Uganda asked, most teenagers face problems of stigma and need much time having fun. How is it going to be done? Because most African countries are weak on this. To answer this question quite lightly, before I pass on to one of you guys, I'd probably say it would be quite good maybe for governments to engage with teenagers that face problems of stigma in ways that is actually interesting for them. I think sometimes there can be a disconnect with the younger generation and the older demographic and how to engage in ways that are actually interesting and enjoyable for them. So doing things that actually allow the youth to be interested and have a fun time whilst actually discussing these issues and bringing it to the attention of their peers. Is there anything you would like to add to that, Chris or Kimi?
Tony, I thought that, yeah, I very much agree with that. I mean, what we found is that you need to work with all parts of a community. So we might, previously we might just focus on the people we're targeting, maybe women and children. But we've learned that we also need to engage the men, elders, other sort of decision makers. And once you engage them, you can build that understanding of different marginalized groups, build the understanding of how important it is to have inclusive services. The main thing is working and supporting the community and working at the community level for us as quite a lot. Kimmy, if you had some thoughts on that.
Yeah, I totally agree on that. Mostly, it's about the readership. It's about
Oh no, we've lost her again.
Maybe we'll go to the next question, Tanya.
Yeah. So Henry from Uganda asked, how can we help the young girls and boys, youths, living with HIV in our communities since they lack enough emotional support and that's affecting their mental health? I'll let you take this one first, Chris, and then I'll jump in. Would you like me to repeat the question, Chris?
Yeah, no, I got it, Tanya. I just wondered, Kimmy, if you were going to come back in on that. Let me take this one. This is emotional and more general support to young people living with HIV. Again, I think one of the really important things for us is that we think about the whole package of support or the whole system that needs to be there for support. So, for example, it's support for medicines and supply chains. It's support for actually community health workers who understand what support and what medical support is needed for those people in their communities, and making sure that they're valued. There's also the other side of it, which is building the sense of rights, so that people know what they should expect and know what they can ask for and have the confidence to do that. And that builds like more quality of the services, which I think is important. And work a lot on primary healthcare, which is trying to think about what are the essential package of services that need to be delivered at that community level. And we do believe that mental health support or emotional support is part of that, and that shouldn't be left out.
Perfect, thank you.
Thank you.
Kimmy, did you want to jump in? Did you want me to ask the question again?
No, Tanya, I got the question. Actually, for me, from a grassroots level, because as a young person, you're always in your community, and these stigmas they always come from your community and their surrounding. I feel like first of all, there's a need of civic education to the communities by the use of the NGOs, which we do have as youth clubs and all those stuff, because we are talking about the mental issue here, which is maybe it can be a cause of lack of interacting with your fellow peers, just because you're feeling that, oh, maybe I'm having this type of disease and I cannot be able to be interacting with this. But then bringing in these organizations in the grassroots level in terms of young people should be able to be interacting with their fellow adolescents. By the end, they'll be busy chatting, maybe having other promotive conversation in the clubs, which they always attend to. And by the end, we can say that they'll be having a mental stability in their everyday activities.
Perfect. Thank you, Kimmy. We're going to take a break from answering questions very quickly, just to ask a quick question over to Chris. So, in response to the video of our interaction with the minister, how do you feel that this has impacted the way you and your colleagues work?
Yeah, I mean, it has really impacted in the way that we work in a couple of ways. I talked about the first way, which was the fact that we are spending much more time listening to young people and adolescents, really trying to include them in our processes when we decide what we're going to do with our funding and what policies we're going to support. So that's a really big way. The other way, we're moving in, we're just starting a new program on support to grassroots organizations. And what we mean is doing much more at that community level that I keep talking about, more directly. So I think previously we were working with very big UN agencies, perhaps, or the World Bank, or centrally with the government. But we do recognize, listening to young people, that we need to support those organizations, sometimes quite small organizations, that are able to work with young people and to build capacity at that level, so that they can, as I said, advocate themselves and have the support that they need to engage. So that's quite a big shift. I think also, responding, we're doing much more support on sexual reproductive health at adolescent or young people level, in terms of building up, working on the education side and the knowledge side, but also making sure that they, if they need to, have access to services. So that is something that we're thinking a lot about, and that was all part of this International Women and Girls Strategy that the minister talked about, that came out. And remember, that had 3 E's. That had educating girls, ending violence against women and girls, but also empowering women and girls. And that empowering includes empowering young people and empowering adolescents on their rights and on their access to the services that they need.
Thank you, Chris. And a question in response to your answer, Lydia from Uganda asked, how can we include adolescents from the grassroots in the planning process up to the implementation, especially on health policy and education policy?
Yeah, I mean, Tanya, you and Kim probably have good answers to that, being involved in this space. Like I said, I think one of the ways is that we can build, help support with funding those organizations to help build capacity at that level as well, so they know how to engage, they can get to the right, they can be convened, we can make sure that their voice is amplified. This type of forum, this Global Forum for Adolescents, is a part of that, right? There's bringing all of these voices, all of these young people together to speak. It's very powerful. So I think we can help support that. So I think that's very important. The other thing is, we shouldn't, what I call, be tokenistic about it. where we say, look, you can be part of this conversation, but you can't be part of that conversation, because, you know, further down the line when we get into implementation. And I think that was a question from Lydia. We do need to commit to saying you'll be involved all the way through, including at the decision-making stage and including when we decide on implementation. And we still need to think through how we do that effectively. But what we've had over the last year or so is a real beginning, particularly at that listening stage at the very beginning of our processes. What we need to do is work much harder, taking seriously young people's views all the way through. But what do you think?
Sorry, yes. Go on, Kimmy.
Actually, I agree with you, Chris, that this also is a platform where we are given a chance as young people to be expressing as well as giving out our concerns, because this is also a part of the planning processes, because we're being able to be asking what are the near future and what are the current plans which the UK government is putting up. So I feel like this is also a great platform, whereas we young people or around the world, we are being engaged to be also providing, pointing out and giving our concerns. Sure.
Thank you, Kimmy. And we have managed to get some responses to our question that we asked in the chat.
Over to you, Tanya.
And that question was, let me just find it again. How can governments better engage with and be more accountable to adolescents and young people? So thank you guys for all your engagement. It's nice to see all your comments. So Dr. Gurpreet Kaur Sandhu says, making parliaments gender responsive and allow young people to join political parties, which I completely agree with. I do believe, again, as we've said, youth voice, youth engagement is a big priority. Someone also said, Ivana Amponza from Ghana said, in Ghana, there is need for more youth-focused community centers that also provide counseling services for adolescents, especially in rural areas. And that leads me to the next question, which is, how can we help the adolescents who are facing gender-based violence? And to answer that, I'll start by saying two things. I think, one, education is necessary. I think raising awareness and removing stigma is something that is key in allowing people to actually understand the kind of repercussions of gender-based violence and how much of an impact it has on the victims. And I'd say finding allies and advocates within your community and peers in your schools, in your community, in your families, that have some type of understanding and awareness surrounding gender-based violence. And if they're older than you, or if there's someone that has a voice that could possibly be more respected than yours, then asking them to help you kind of raise your voice, make noise about it, and engage with other people in kind of decreasing gender-based violence. And then once that kind of community, that message is spread throughout like the community and more rural areas, going up to, you know, decision makers and leaders, and allowing that to go from there. Do any of you want to add an answer to that?
I think that was a great answer, Tanya. So nothing further from me.
Great. Kimmy, anything? Or should I move on?
No. Should we go to the poll results?
Yes.
They're out.
Let's see what's come up. So from our first poll, which of these areas highlighted in WYPW would you consider your top priority for adolescent health and well-being? So at the top spot, we got mental health support at 33%, support for education skills at 30%, increased provision of well-being services at 17%, action on gender-based violence at 7%, action on climate catastrophe at 4%, lowering ending road traffic death at 2%, and others at 2%. So our top two were support for education and skills and mental health support. Do you guys have any thoughts on those two?
Yeah, I mean, we've heard, and we heard from in the video, didn't we, that education and skills, also jobs, was the top priority, and the UK has been really prioritising, particularly girls' education, as the minister set out. But interestingly, we don't do a huge amount on mental health. We've been very focused on, infectious diseases through our support to the Global Fund and to Gavi, immunisation of children, and very focused on reproductive health and rights, so that we can reflect on. I talked about the fact that we do believe it should be in package of this essential services at primary healthcare, but maybe we can do much more on that. What do you think about that?
Totally, it's true that a lot of people and a lot of governments do not prioritize issues to do with mental health. But we understand that without mental health, nothing can work around. As well as I totally agree on the issues to do with education and skills, because we young people, I can say from the perspective of Malawi, we are really facing issues to do with employment for young people. So if investing in this kind of support for education as well as skills, it can really save the young people around.
Great, thank you guys for your engagement with that. And the second poll we got was, do you feel heard by political leaders? 49% of young people voted no, 33% voted a little but would like more, and 16% voted yes. And I can completely understand why these were the results that we got from the poll. I think it is up to a lot of political leaders to actually take a stance on engaging with young people and not making young people take the first step, but instead approaching young people and asking, what do you guys need help with? What can we do? How can we improve on the situation in front of us? As young people, it is not our duty, I think, to kind of save everybody, but the people that have been put in power and put in these places to take the lead on that. So yeah, any quick comments from you guys?
Yeah, I mean, 49% saying that no is partly why we're here, right? This is what these 2 days are about, and we need to change that. And as I said, I think there's been a beginning. I mean, it's a bit encouraging that 33% said that a little, but they would like more. And that's maybe higher than it would have been a few years ago. So there is a beginning there. There's a journey we need to go on. But as I said, we need to do a whole lot more. And I really feel that this will be like a revolution, a sea change in the way that we engage young people. And we can build on this event and similar initiatives to change that dynamic.
Thank you, Chris. Any quick comments from you, Kimmy, before we wrap up?
Yeah, I totally agree to say that it's true that a lot of people can say no just because most of the times a lot of young people are never engaged in issues to do with the planning as well as the coming up of different issues to do when it comes for them to be doing the planning for development. So by the end, we always feel like maybe our concerns were never heard, but the government different governments should improve in adding us in different points as well as in different steps where they're coming up with different policies as well as different issues to do. So from there, we're going to say, yes, we're being heard. Because when I give up a point and they address that, that means it's totally a yes.
Great.
Thank you,
What a
Kate.
great place to end.
Yes, didn't that go fast, guys? I feel like that went very fast. It was so nice being here with you guys. Thank you all for engaging in the chat with us. Thank you for watching the video. We had a great time speaking with the minister, had a great time engaging with you guys as well. This, again, is one of the great ways to just allow your voice to be heard. What you're saying is making a difference. What you're saying is being seen. You saw from the video that we were able to speak with the minister of the FCDO, and we actually were heard and were able to share with you guys. So making sure that you just, take time out to kind of, whatever's your heart's mission or what you're passionate about, letting that be known and making some noise about it. Thank you, Chris. Thank you, Kimmy. If you guys have anything to say. But thank you guys so much, and it was great.
Yeah, thank you to you, Kimmy and Tanya. What a great session. It's been great to meet you. And we will look at the questions, everybody, all the comments that have been made, and keep watching the rest of the Global Forum for Adolescents.
Yes. Thank you.
Yeah. Goodbye,
Thank you,
everyone.
everyone. Bye.
Bye, guys.